Hello and welcome to Health Chat program. This is a program that looks at various health issues and other related issues concerning our health. We are here at Intercontinental Hotel where we want to interact with Ministry of Health, where they have organized, a workshop, technical workshop, working group with different stakeholders, and we just want to hear as to why this workshop has been, brought up to this state. And so I have with me a senior, person from Ministry of Health who's going to interact with us and just fill us up with what is going on here. Welcome to today's program.
Thank you.
All right, kindly tell us your name, your position, and what we are doing here.
Okay. Thank you very much, Madam Faith. My name is Constance Msenge. I'm the Chief Health Promotion Officer from the Ministry of Health. And what we are doing here today, as you can see, we are holding a quarterly National Technical Working Group meeting for health promotion officers. And not only officers for the Ministry of Health, but also with our stakeholders. Our stakeholders, as you can see, we have the line ministries, yourselves, Ministry of Information, we have local government, we have Ministry of Education, we invited also Ministry of Community Development, and all those that participate in health services. Then we have the civil society organization, those that give health promotion to the community. We have partners that support all the health promotion activities, including CHAS as well. So this meeting happens quarterly. This is where we speak about how are we performing in the health promotion space. So we are looking at how have we performed, what are the areas of improvement, what should we do better. So under the Ministry of Health, we have subcommittees, like you have seen people have been presenting. So we start on priority areas of health. For example, we started with ourselves health promotion, which is overhacking in giving health promotion to the nation. So in this we have HIV, adolescent health, we have public health itself as a unit. We are springing all of us from public health unit. So we have also malaria presenting, ZNPHI, all the thematic areas of priority, maternal health, all those things we are looking at them. So the importance this time around, we have also called the provinces. So all the 10 provinces are here and some selected districts. Why we have done that, we are looking at how best can we give information to the people so that we get feedback and we see the areas of improvement. And even now, as we are, even the partners, they get to know who is doing what and where, so that we do not duplicate efforts in health promotion. You have seen from the presentations the disease burdens. Where are we not doing well? What best can we do? How can we make better concerted efforts to respond to NCD, non-communicable diseases, malaria, HIV infections? You have seen nutrition, immunization, including immunizations. We still have 0 doses in the country. How can we reach that child? I think that's what we are doing.
Great. That is actually quite mouthful. But if you look at, the people that you brought in, and you're talking of quarterly, reviews, and why are these important if we were to zero in into that?
Yeah. So a quarterly review is very, very important because it makes your intervention, you have to redirect interventions. Quarterly review means you look at the performance. Where are we not doing well? It's like we are doing monitoring and evaluation quarterly. So that when we see that here we are not doing very well, the indicators, for example, social data is very difficult to measure. So we are using indicators in the quarterly report, which is also done by our planning and monitoring evaluation. We go into the DHIS too. We look at where are we having bad indicators that are falling. Is it in maternal health? If there are fewer women who are going to book for antenatal health. Are we seeing malaria cases increasing? Are we seeing HIV increasing? Then this meeting will inform us to say, no, we need to double our efforts only where we have falling indicators. So even partners like you have seen, we have been lobbying with the partners to say we need to have concerted efforts, including the provinces. We have called them to say, where do you have a gap? I think you have seen people looking at it. Here we have a gap. We need more partners to come and support us. And from this, it gives us the direction that we need to face now. Going forward, I know, like you have seen, people are complaining about STIs, and I think now you have seen that we are going to double efforts against the STIs. We are going to the double efforts towards reaching more adolescents and the young people and to do their programs in the spaces that they need to be reached out to, whether on HIV, on sexual reproduction, and we are going to double efforts even in blood transfusion. I think blood transfusion services gave us a very strong point to say they need more blood, they need more donors, and it is these platforms that we are saying they participate in the community spaces wherever they are working from, and we bring on blood donors, we recruit more so that we save the children, we save lives, especially towards maternal health.
Indeed, as a ministry, I'm sure you're doing quite a lot in terms of, publicizing or giving out messages, to the general public. And just as you have mentioned, you're leveraging on this partnership which you are having with so many other actors, that are looking at issues to do with health. But what would be your word to would-be, partners who feels they can actually come and reach out to you to have this concerted effort so that we reach out to the masses and those places that you feel other partners can come in and just help? What would be your word to them?
Thank you very much, Faye. And on this one, we are not only looking at the stakeholders that are with us already as a Ministry of Health. We are looking out to anybody, be it an individual, the corporate world, the partners. Some of the partners are not here, but we are calling everybody to participate in health. So we are calling wherever you are, if you are an individual, what can you do for health? What can you do to reduce disease burden? How can you support even civil society organizations, the community-based volunteers, that they spread the word on disease prevention? We are promoting to say now we are looking at how best can we enter into the communities, because once communities are empowered with knowledge, skills to prevent disease, we think we will have a better Zambia that is health. And we know that a health nation is a productive nation. So we want anyone to support. For example, we want to be on radios, on your TVs, and this costs money. We are requesting for corporate world, civil society organization, partners to support airtime for us to be able to reach the media houses. We are requesting you to come and look at what are the challenges Zambia is facing. We are talking about STIs are increasing. We are talking about young people should be involved in participating to better their lives for health. We are requesting media houses to come through to us and also spread the information to empower people with knowledge and skills on health. How do we prevent disease? For example, how can we prevent cancers? That is a non-communicable disease. Yeah. How can we prevent heart diseases? That is associated with lifestyles. We want people to know that if you are exercising very well, you are eating healthy, no smoking, you are not using any tobacco in any form, you are drinking a lot of water, and all those things, you are having safe relations, you are protecting yourselves, you use condoms. If you are on treatment already, you are following your treatment guidelines as advised by the doctor, then it will be better. Remember, health promotion, people, maybe it's not only on the prevention side. Health promotion is throughout the cascade of care from before the disease occurs. We don't want you to have the disease. We want you to be. We don't want you to have the disease. If you have the disease, we want you that you follow your treatment guidelines and you are productive. And if already the disease has advanced, we want you to be productive so that you are rehabilitated better and you live with your condition. So that is what health promotion is. And even mental health. There are a lot of mental health cases we have seen, maybe because of so many things. Mental health presented, of course. We have facilities. Chainama Hospital is available, counselors are available. And if you have any problems, our health facilities throughout the country are able to handle. So I'm requesting people, the public, to go to the nearest health facility for more information.
For more information. Well, I have gotten actually a very valuable, resource here in terms of information, and I know that as Ministry of Health, you're actually doing quite a lot.
Yeah.
Looking at the different ailments that we are looking at. We're talking of heart disease, we're talking of cancers, we're talking of mental health, adolescence, and all that. But maybe what would be your word to the general public when it comes to, accessing this information and doing the right thing instead, in terms of decision making once they get this information, because this is what we're promoting here, taking out the information, health information for people to take and make rightful decision. What would be your word to the general public?
Okay, thank you very much. So the thing is, if you are not feeling well, or you just want, usually people do not even go for checkups.
No. Only when you are sick.
Only when you are sick.
Yes.
So we are saying, please go for screening. For example, some of the things, for example, like the cancers are silent. You cannot know.
Yes.
Sometimes you have maybe a bump on your body. You are not feeling okay. You go for a checkup to the hospital. For all women, we are saying, for all women, go for cervical cancer screening. We have 116 districts, and in all those districts, we have cervical cancer clinics. Go for screening. And the immunization, take the children for immunization. They will be prevented against diseases. Even for cervical cancer, we are saying all those girls aged 9 to 14 years, take them for immunization. All the under 5, take them for growth monitoring. Ourselves, let's go. When did you have your BP checked, last checked?
At least that one, I am sure I took it about last week.
Let's avoid junk foods. Let's go healthy eating. Let's love vegetables, fruits, and let's eat our natural foods. Let's go back to the drawing board so that we keep healthy, we wash our hands, we avoid congested places, and let's be clean. Let's maintain our hygiene. Let's drink safe water. The cholera might have been declared over, but we have to continue on that trajectory of boiling our water, adding chlorine, and all those things. Pack our lunch boxes for our school going children. Pack health lunches, health sandwiches, all those things, and fruits. Even in the villages, let's use the chiwantu. Let's use our natural foods. Yes. Candolo now is there.
Yes.
And those are the best because they will keep us healthy. Yeah.
Madam Constance, thank you so much for your word of insight.
Thank you so much.
All right. Well, viewers, you've heard it all for yourselves. We were chatting with a representative from the Ministry of Health, just taking us through on what this technical, working group is doing here at Intercontinental, looking at various health issues that concerns our well-being and our wellness. They are talking of health promotions. What is it that should go out to the public, and how should the public actually look at it in terms of decision making? As she mentioned, a healthy nation is actually a wealthy one, and so let's look out for health issues, be it online as well as offline. From me, Faith Mutale, and the entire production team, it's bye for now.